Kay Belin prides herself on good health. She eats right, exercises, and listens to her body.
This truly was a sort of weight right in the middle of my chest, and then it would radiate to my upper arm right here, and that felt like a heaviness. It's as simple as that.
Frequent chest pain sent her to the hospital, where she learned she was one of the millions of Americans with a blocked artery. It was keeping her heart from getting enough oxygen.
There are some blockages that are better treated with medications, and there are some patterns of blockage that are better treated with bypass surgery. But certain patterns can be very well treated with a stent.
A stent is what he recommended for Mary Kay. Angioplasty alone opens the blocked artery, but too often it's simply closed again. Building on that technique, surgeons often add a stent. It's a mesh tube that, once inserted, expands and keeps the clogged artery open.
With a traditional angioplasty, that risk of blockage and scar tissue forming at that site could be as high as 30 to 40%. With a stent, to keep the blockage open and the plaque propped out of the way, the chance of blockage coming back is reduced to somewhere in the range of 10 to 15% with our older stents.
Newer stents are sometimes drug-coated to release medication that keeps the body from forming scar tissue.
Typical stent sizes range from 2 to 4 millimeters, so they're quite small.
Once inserted, the stent stays in place forever.
There's not a certain amount of time that a stent is useful for. We never remove them once they've been placed. They're in forever.
And in Mary Kay's case, it could be a long time.
My husband has always said to me, "You're going to live to be 100.
For Lee Memorial Health System, I'm Amy Osher.